Hello everyone, welcome to Doc Med. My name is Uyi. Today's topic is on Seizure First Aid. A seizure is a result of abnormal electrical activity in the brain. Sometimes it's hard to tell when a person is having a seizure. It can be unnoticeable, where it looks like they are staring off into space or daydreaming. Or in some other cases, person can fall, lose consciousness, or suffer convulsions. Seizures can affect the person's behavior, their movement, their feelings, and their levels of consciousness. If a person has 2 or more seizures, they are considered to be epileptic, or if they have recurrent seizures. A person with epilepsy can have different types of seizures affecting them. Seizures are not diseases themselves. They are more of a symptom of a disorder or a disease affecting the brain. The signs of a seizure depends on the type of seizure. The type of seizure depends on what part of the brain is being affected. Most seizures last from 30 seconds to about 2 minutes. Please, if a person or you yourself have experienced a seizure that is more than 5 minutes long, see a doctor. It is called a medical emergency. There are 2 main types of seizures. There is the focal onset seizure, which is basically the type of seizure that affects one side of the brain. With this kind of seizure, one can be aware that they're having a seizure, or it can also affect their level of consciousness where they are not even aware that seizure is happening. The other type of seizure is called generalized onset seizures. These seizures affect both sides of the brain at the same time. The common types of generalized onset seizures are atonic seizure, tonic-clonic seizure, and absent seizure. Tonic-clonic seizure is the one where you see the convulsions. They are referred to as grand mal seizure. They cause jerking of the hands and legs and the stiffening of the muscles. With this seizure, a person can lose consciousness, and they usually last a few minutes. Absent seizure is also referred to as petit mal seizure. This usually lasts a few seconds, and they usually look like the person who's experiencing it is daydreaming because they stare off into space. So the last common type of general onset seizures is atonic seizure. So in this type of seizure, the muscle goes limp, and you notice maybe the person's head just suddenly nods to the side, or their body can fall to the ground. This seizure usually lasts about 15 seconds. So you're probably wondering, since there are many types of seizures, what can I do? How can I help them? Well, I'm going to give you a list of things that you can do when a person is experiencing a seizure, no matter the type. But the first thing you should know is that seizures are not usually medical emergencies unless the following things are true. This is the person's first seizure. The person has difficulty breathing. This will be maybe during the seizure or after the seizure. The seizure is lasting for more than 5 minutes. The person has another seizure soon after the first one. The person is hurt during the seizure, or the seizure happens in water. The person has a health condition like diabetes, heart disease, or they are pregnant. For those situations, please take them to the emergency room immediately. Well, when a person is having a seizure, no matter what type of seizure it is, the first thing you want to do is stay calm. Make sure others around you are calm. The person is not being crowded. Stay with the person until the seizure ends. And when the person is alert, you inform them who you are if they don't know you. Explain to them what just happened. Try to calm them down, because it's a scary situation for the person experiencing it and for people around. Check to see if the person is wearing a medical bracelet or any other medical information that you can get from them. If they are not at home, offer to call them a taxi. Just make sure they get home safe, unless it's a case of medical emergency.
So as you can see, a group of people hanging out, having a good time, when suddenly one of them will experience a seizure. The first thing you want to do is make sure a crowd does not form around them. The next thing is to secure the head. If you can do both simultaneously, that would be awesome. So you guide their head as they fall, placing anything soft, whether a cushion, your jacket, a piece of clothing, just to protect the head. Remember to contact emergency services if you don't know who they are. You also want to make sure you know when the seizure started. So check the time, and after that, loosen any tight clothing. Again, you don't want them to choke, so anything around their neck, try to loosen it, whether it's a tie, a button-up shirt, a jacket. You want to remain with them until the seizure is over. When it's done, if they are still unconscious, put them in the recovery position, which is placing their hand by their cheek, raising up their leg, and then turning them to the side. This will prevent choking. So you wait until they are fully alert. Check the time to make sure you know when the seizure ended. Again, it's important to know how long the seizure lasted for. When they wake up, you want to explain to them what happened, assure them, and gather whatever medical information you can. This is a 3-step process from epilepsy.com on Seizure First Aid. It will be posted down below in the description box for your downloads.
Now, things not to do when a person is having a seizure. Number 1, do not put anything in their mouth. It's not possible for you to swallow your tongue when you're having a seizure. Don't put your finger, don't put spoon, don't put anything in their mouth when they're experiencing a seizure. If the person is having a convulsion, do not try to pin the person down or restrict their movements. The best thing you can do at that point is to clear the space and let the seizure play itself out. Do not try to do mouth-to-mouth resuscitation immediately after a person has experienced a seizure, because majority of the time after the seizure, they are usually able to breathe on their own. Only do CPR if this person is not breathing and you know how to do CPR. And even if it's a case of the person not breathing, again, in those cases, you want to rush them immediately to the hospital. Not try to put food or water in their mouth until they are fully alert. When they wake up and they understand what just happened, then you can offer them food or water. So that's all for today. If you enjoyed this video, and even if you didn't, please share, because this information can be very useful to the next person, could help save your life. Subscribe, like, comment. I look forward to reading your comments and any suggestions for whatever topic you want me to talk about. Thank you. Bye.